I'm Maura Carley, founder and president of Healthcare Navigation, and I'm taping today the segment on our story to share with you a little background on us, what we do, and why we're so passionate about it. A word about my background: I was very fortunate to have executive level positions in healthcare in various parts of the field early on in my career before starting Healthcare Navigation. Interestingly enough, on the health plan side of things is where I first learned how ignorant people were about healthcare coverage and health insurance. It's easy to understand when people are young and healthy, but it is one of our most important financial protections, so it's very important to make the right choices about healthcare coverage and health insurance. Anyway, in the first few years of our business, we dealt with very significant, dramatic disputes. Often there was a baby with a very serious condition, or a toddler, or we had a young girl who needed a bone marrow transplant. So these were always disputes where the insurer denied claims for services, or there was just an unbelievable claims mess that the family couldn't handle, or life-saving services were being postponed because the insurance company hadn't approved them, where the family and the family's oncologist wanted the child to go. The good news about any of those awful situations is that we won all of those cases, those very stressful cases for all involved. But what we learned is that most disputes, if you know your coverage and you know how to navigate the field, are avoidable. And that's what led to our starting our subscription advocacy services, which are for clients who have a long-term relationship with us, usually forever. And they hand things off to my staff and to me for management. As a result, it's my staff who are reviewing their insurance statements, their medical bills, making those annoying phone calls we have to make for ourselves. And for some, this service is just something that saves them time and aggravation. For others, it's much more important, because if they didn't have us, they'd clearly need someone, either a family or a friend, who understood how to navigate the field. The other side of the business is coverage transition, and it's just what it says. You know, there are many events in the United States that foist us off our coverage. Our children turning 26, losing our jobs, COBRA ending, divorce, death of a spouse, retirement, going on to Medicare, so many. And while we're in the working world, which is a blessing for most of us, our human resources department is helping limit the choices we need to make. Once we don't have them anymore, it can be overwhelming. And there are those who would say choice is a very good thing, but too much choice, in my opinion, is not, because people aren't informed enough to deal with that much choice. And frankly, there are some very unsavory characters in our field selling things to people they don't need. So, to give you an example, you would think Medicare would be simple, but it's not. What happens is that new regulations and new legislation, and just as time goes by, there's no one working to streamline things, so they just get more and more complicated. So Medicare was originally Parts A and B. Later, Medicare supplements came about. They're private products, but they're regulated by the federal government and the state governments. Later, Advantage plans were formalized in the 90s, and then Part D began in 2006. And if you're going on to Medicare and you live in a major metropolitan area, you usually have a choice of 20-some Advantage plans, 20-some Part D plans, and many, many more supplements. So we do not sell insurance. We manage the transition. We do not accept commissions. We work directly for our clients without conflict for a fee. So that is who we are. And in the future, you will not be subjected to just my talking head, as my very capable staff will join me in taping these videos. So thank you for listening. Give us your feedback and comments. We'll incorporate those in future videos. Take care.